Hi, this is Dr. Toby, your host on Health and Wellness with Dr. Toby. Thank you for joining us. Don't touch that dial. We have a great show today. Our guest is Dr. Christian Vale. Yes, his name is Christian, and he's a Christian, and he's here to open up a new branch of the Foot and Ankle Clinic in Monroe, Louisiana. The address is 3601 Desert Street, and it's a brand new practice. He's going to be sharing everything and anything about podiatry. He's a surgical residency trained podiatry specialist. He's going to be sharing his history of how his parents were born in El Salvador and they moved to America and he pursued the American dream. He went to Penn State, got his degree in exercise science, then went on to the university in Cleveland to get his diploma, his degree in podiatry medicine, and afterwards he went to Long Island Jewish to do his surgical training. He's extremely well trained. He's going to be a blessing to you. Don't miss this program. It's a blessing. Look forward to seeing you. Jesus is Lord.
Valley. Okay, I like Frankie Valley.
Hi, this is Dr. Toby Moma, your host on Health and Wellness with Dr. Toby. Thank you. Don't touch that dial. We have a great show today with Dr. Christian Valley. Dr. Christian Valley is a podiatrist who just moved into the area. He's with the foot and ankle specialist in Monroe and West Monroe. Partner is Luke Hunter. We just want to let everybody in the community know that there's a new podiatrist in town. We're going to put his address on the screen. He came all the way from Northeast mostly. He grew up in Maryland. He went to Penn State for his undergrad in vertebral physiology and neuroscience. Then he went to Kent State in Ohio, Cleveland, Ohio, for his podiatry training. After that, he went to New York, Long Island Jewish, and Northwell Hospital, and he got his specialization in podiatric surgery. And he's here with us here in good old West Monroe, Louisiana. He's here to be a blessing, an impact, to share his knowledge about podiatry and what podiatry is. So you're welcome on the show.
Thank you.
Thank you so much, Dr. Christian Valley. Real pleasure having you on the show. So a lot of my viewers have never heard of a podiatrist. I mean, to them, a doctor is somebody who looks at their heart and checks their lungs, and now you come along and you say, I'm a doctor of podiatry. So first and foremost, what is podiatry, if I may ask?
So what is podiatry? So podiatry is a doctor that specializes in the foot, ankle, and lower extremity. They treat any kind of ailments that occur in that region. In most states, it's, as stated, anywhere from the from the knee down. And as a podiatrist, we can treat anything from ingrown toenails, warts, to plantar fasciitis, heel pain, as well as major things like Charcot issues that diabetics run into, as well as ankle fractures and tendon injuries and ligament injuries. But basically, it's an interesting field, and we also have the availability to work with wound care.
Okay.
So we work with some very sick patients, but we also work with the very healthy and the very young.
Now, let's go back a bit. You went to Penn State, one of the top schools in the country, then went to Kent State. What made you, after Penn State, pick podiatry? I mean, you could have gone into medical, dental, pharmacy, whatever field you could have been a physical therapist, you could have been sports physiologist, exercise physiologist. Because I know there are people watching who are interested just by hearing your voice in this field. So I want you to give them an idea how you navigated through undergrad into grad school of podiatry.
So absolutely. So it actually started with more humble roots outside of Penn State. I have a good family friend that is a podiatrist in Maryland, and also a very good friend that's an orthopedic. And when I was in high school, I had an opportunity to go with them and work with them for the day. I enjoyed both realms, orthopedics and podiatry. But podiatry, it kind of clicked and felt a little bit more like home, just because when it comes to podiatry, it's a patient comes in and you have the availability and the potential to have them walk out of that room feeling so much better. If it's as simple as debriding a callus and taking down a callus, or helping with a wart they had, or this heel pain that they've always had issue with, you have the availability to have them walk out of that room and out that office feeling so much better. But not only that, podiatry does have, you're specialized right off the bat. So with orthopedics, you obviously have to do general orthopedics and then specialized later on after you've completed a residency training. But with podiatry, because you are a podiatrist and you have a specialization in an area of the body already, you can automatically be specialized in an area and go to a residency program and get your training and basically work on that specific thing. And so it's already tailored to exactly what you want to do, the foot and ankle and lower extremity. And another big thing is the work and the family, the personal life is a lot better as a podiatrist.
Wow. So we have this object in front of you here. So I want you to just, my audience is full of a lot of 50, 60, 70-year-olds. And a lot of them have warts, diabetic foot. Tell them what your office can do for them using that model in terms of how do you improve their overall foot.
Yeah, absolutely. So some of the bread and butter things that podiatrists we work with on a daily basis are obviously toenail fungus. So obviously on this model does not have nails or skin on it, but that's a big thing that we work with on a daily basis is people's complaints of nail fungus. In addition to that, we also have patients that will come in with heel pain. And we are specialists of heel pain per se. And they'll come in and say, oh, I was told one time that I have a heel spur and it hurts, but I wasn't sure if there's anything that can be done for it. And there's absolutely 110% something that can be done for your heel pain, whether it's orthotics, whether it's injections. And when a patient comes in and describes their heel pain, we do a very good job at educating them on the reason why this heel pain is occurring. There's biomechanics that are involved with it. You have your Achilles tendon, and on the bottom here you have your plantar fascia. And the plantar fasciitis, which is a big cause of heel pain, is caused by that plantar fascia that's attaching to this location down here in this area, and it's pulling persistently in this area, causing an inflammation. And it's a vicious cycle of inflammation that occurs. And as our job as podiatrists is to break them out of this inflammation, this vicious cycle of inflammation. And that's the only way that we can get them back on their feet pain-free. In addition, we also have patients come in all the time complaining of hammer toes. Wow. So if you ever have your toe sticking up like this and think, oh, I can't do anything about it, I have a corn on here and then I'm developing callus on here.
You can't wear your shoes like you normally would.
Can't wear your shoes like you normally would. There's things that we can do conservatively, to assist with you with this hammer toe. Obviously, there's surgical procedures as well, but we want to treat everybody conservatively. Surgery is simply a tool in the toolbox. And all of the ailments that we can deal with, we 110% try conservative care first. So like we were talking about with the hammer toe, could be something as simple as changing the biomechanics of your hammer toe in order to have it what's called plantar flexed. So cushioning the bottom of the foot here in order to assist with the movement of this toe. Wow. Sometimes it's as simple as a tendon that's contracting on this area that's causing this toe to crank up like this. So in addition to that, people always say, oh, why am I developing this corn underneath my foot? And that's, once again, when you come in the office, we take an x-ray and we take a look at what's causing this corn and what is going on in that location per se. So a lot of the times, people with a flatter foot would develop corns on the outside of their big toe here and on the bottom of their fifth toe here. And that has to deal with the biomechanics of what's going on in your foot when you have a flatter foot. You're not propulsing as much as correctly, and so you compensate by turning this toe more and putting more pressure on the outside of your toe. So a lot of people will come and say, I know I have a flatter foot, but why am I developing this corn on the outside of my toe? And it's because of the pressure. The body produces more skin and then tougher skin in an area that you're having this increased pressure because it wants to protect the bone and doesn't want to break the skin, for lack of better words. So that's some of the big things that we treat.
Tell me, does the person's foot give an indication of his or her health? I mean, if I look at your feet, does it tell me anything about your overall health head to toe?
Yeah, I think it absolutely does. Not only just because as a podiatrist I'm saying that, but I definitely think
You
that.
look at feet all day
Yes,
long.
I look at feet all day long. Exactly, but it absolutely does. I have patients that come in, and I can tell them just by looking at their feet that they've been a smoker for an X amount of time, and just the appearance of their tissue, their skin, their nails, you can very much determine what's going on in the overall health, and that's why diabetics come see us on a daily basis, because that's a big indication of what's going on internally.
Right.
Things like neuropathy, things like vascular issues, circulation issues. One of the first places we can catch it is in the foot.
I don't know if your partner gave you an idea what the pathology here in Louisiana is. Obviously, you trained in New York and Ohio. Did he give you a clue? You just came over, so I don't think you've seen that many patients, but did he give you a clue what the number of maybe diabetic foot or the number of peripheral artery diseases or the number of foot ulcers in our area is smoking related? Did he tell you?
I know it's very
pathologies
prevalent. Yes,
are?
it's,
Right.
diabetes is very prevalent, especially in the South, but as well as arterial disease due
Right.
to smoking.
Smoking is.
And that's one of the biggest causes of that arterial deficiency is smoking. So absolutely.
You won't believe it, but I think the South has one of the highest levels of amputation
Really?
for bilateral feet, or TMAs or BKAs. If you look at the demographics, it's almost twice the number in the Northeast.
Wow.
So it's something that I think podiatrists can make a difference with.
No, absolutely, and it's
educating them to avoid them getting to that point of amputation.
110%. And that's why every patient that comes in, I tell them, hey, if you know somebody that is a diabetic or that has circulation issues, tell them to come in. If we can catch things early, that is the best preventative care. We catch things ahead before we start having issues.
So every diabetic should see a podiatrist
110%.
once a year, or
Well, that
depends on what their complications
exactly.
are.
So
Right.
when a diabetic comes in, we characterize them as either being high risk or low risk. And then based on our evaluation, we determine the length of time that we go between seeing them.
What do you do for the diabetic when they come in for a routine visit? Just routine, what do you do on the table?
So on the table, as soon as the patient comes in on the table, I talk to them about the reason why they're there. Because a lot of patients come in and say, my primary care doctor sent me. I don't know. They told me to come see the foot doctor. And the reason why primary care doctors tell their patients that are diabetics to come see a podiatrist is just kind of what we kind of touched on, is because we can start looking at the foot and kind of evaluate to see how systemically what's occurring. So, when a patient comes in, I describe and I tell them, when your sugars are elevated for a long period of time, you start developing nerve pain. And that's due to the fact that sugar is obviously delicious, but at the same time, it's very harmful, and it's harmful to tissue. So our nerves are very much affected by when the sugar is extremely high for too long. And because of the small fibers that go into the feet, they're not the large fibers that come from behind the back and go through the leg. These small fibers that are down at the feet, they're affected very early on, and they're one of the first tests. That's usually the neurological exam is one of the first things I do, because that's usually the first thing that a patient says is, I heard about this thing, neuropathy. What is it? Kind of tell them that general spiel, but then we go in and we test them with it's a Sims-Weinstein.
Okay. I call it a monofilament.
Monofilament, correct. Monofilament. It's not, and I always tell patients, it's not a needle. It's a fishing line. It's in essence a fishing line. And then we test several spots on their foot, on the top, on the bottom of their foot, to detect whether they can feel this protective sensation. And this protective sensation is vital for anybody in general, but more specifically a diabetic. So when they're walking, they can feel if something is sharp in their shoe, if they're stepping on something sharp. Then we test their vibratory sensation with a tuning fork. And we test to see if they can feel that vibratory sensation on the big toe. And if they don't feel it there, we move back to kind of gauge where they finally start feeling it. Because neuropathy, it's a progression, as is diabetes. It's a progression, and it's a spectrum, and we need to stop it early on. So on top of the neurological things that we look at, we look at dermatological conditions. So are they developing calluses in certain areas? Because if they're developing calluses in certain areas, that means that there's a bony issue going on. There's getting too much pressure in certain areas. And with the diabetic, a callus is automatically a preulcerative lesion. And that's the buzzword there, an ulcer.
Okay.
You tell somebody it's a preulcerative lesion, and their eyes blow up,
Right.
because that means this could have the potential of
become
becoming
an
something.
ulcer.
Exactly. So if we see a callus, we analyze the foot and explain to the patient, why is this occurring? So we look for calluses when we're going through this dermatological thing. We're looking at their nails, because as a diabetic, your immune system is down, so you don't fight off certain fungus. Straightforward, let's go to it, fungus. So you're more susceptible to develop a fungal infection. Patients will say, I all of a sudden start developing these ugly nails, and it's unfortunately a progression of the disease. So we're looking at the texture of the skin. Like I said, you can tell by the thinness of the skin, if it's shiny, if it's red when it's laying down, and next thing you know, when you lift the foot up, it just becomes white. That signals a vascular issue.
Okay.
And then lastly, we ask them to just do several different musculoskeletal tests.
Okay.
Push your feet down, not like you're doing a gas pedal. Don't let me push your feet in. Don't let me push your feet out. And the reason why we do that is because, once again, sugar works and attacks on those tendons. And when they start hardening those tendons up, we start developing contractures. And once again, it's a progression.
Some of my patients hate surgery. They're afraid of surgery. They don't want the knife. So what alternatives do you have for calluses other than debridement?
So the big thing with calluses is kind of what I touched on. It's all about pressure.
Okay.
So yes,
you change the pressure.
exactly.
So maybe.
But we take an X-ray, and a patient will say, I have a callus on the bottom of my big toe. Well, let's take an X-ray and see what's going on, because calluses are pressure. So if we can identify what's causing that pressure, then we can do anything to alleviate that pressure, whether it's an orthotic or putting into supportive shoes to help with your ambulation, because these calluses are developing because of problems while you're walking. So absolutely, conservative treatment is the best treatment.
Okay.
So supportive shoes, orthotics. Obviously we have to debride it in order to or we have to take a scalpel to it to shave it down, because that in itself, that hard tissue pressing up against that soft tissue, it's painful. Absolutely, because those nerves are not in that hard tissue; it's in that soft tissue. And when you're stepping down, it's going to be extremely painful.
Right.
Exactly.
A lot of my viewers are curious. What happened in Ohio? What was your training? How many years? They don't know Kent State, so give them an idea. They don't know Long Island Jewish Northwell Hospital. They want to check out this new doctor in town. So give us a bit about your training, and you obviously did an extra year of surgical training. So tell it, or maybe even more than a year.
So basically, after undergrad, in order to become a podiatrist,
Okay.
After high school, you go to undergrad, and most schools, podiatry schools, require you to at least complete your undergrad, whether it's a BA or a BS, and as well as taking the MCATs, just like if you were trying to apply to medical school, to an MD or a DO school. So you still have to apply. You still have to take the MCATs, and you still have to have GPA restrictions and things like that. So once you do get accepted to a school, so like me, I went to Kent State. It's in Cleveland, Ohio. I believe there's 9 podiatry schools in the country.
Really?
There's 9, correct. The closest one to here is in Florida. It's called Barry University.
There's one in Texas.
It's in the works.
Really?
Yes, it's not open just yet. The last time I heard about it, they were just talking about potentially starting it, but that's the closest podiatry school.
Oh,
correct.
Wow.
And then after that, there's several kind of scattered around in the Midwest, and then obviously in Philadelphia, there's Temple University Podiatry, and then the New York school as well. So
Luke, your partner went to...
He went to Scholl, which is in Chicago.
Oh.
Yes. So
wow.
yes. So in Ohio, or you do a podiatry school, which is 4 years, just like med school.
Just like med school.
Exactly.
Right.
And the first 2 years are very similar to med school as well. You're doing general anatomy, you're doing physiology, histology. Those first 2 years, in some schools, you're actually taking those classes with the
Medical
MD,
student,
with the medical
right.
students. And then the last 2 years of podiatry, that's when it starts changing. That's when you really start getting to the specialization of what podiatry is. So you start doing rotations that are tailored to podiatry, but you still do outside rotations with the medical students. So even during my 3rd and 4th year of podiatry school, so that's putting me 7 years into education at this rate. At this point, that's when I'm rotating in the emergency room with the medical students, rotating orthopedics, different things like that. We still have those rotations as well, but once again, those last 2 years, it's all about the foot and ankle.
Oh, wow.
So then after you finish podiatry school, that's when you apply to residency. So that's where went out to New York City for my surgical residency at Long Island Jewish.
Was it 1 year or?
It was 3 years.
3 years. Oh,
3
wow.
years.
I didn't realize it was
Yes.
that long.
Yeah, it's
but
3 years.
Not every podiatrist has to do a residency. Am I correct? Or
So-
that's not the same anymore?
It's at one point in time you did not have to complete a
Okay.
residency,
But now you
but
do.
now most states at least require you to be have a full license to have completed a residency.
Okay.
So I did my residency, like I said, in New York City, and it was a 3-year surgical residency. And then we start getting into kind of the difference of some
Right.
residencies, because not all residencies are the same. Some of them are what's called PMSR, which is podiatric medicine per se, but you're still doing the surgical aspect, but you're not doing the reconstructive rear foot aspect of it and the ankle training. So it's mostly tailored to a forefoot and midfoot kind of specialization. And then with that added credential of an RRA, which is the one that I did, it's reconstructive rear foot and ankle. So our training involved not just the front aspect of the foot here, but also the rear, the hind foot, and the ankle, and as well as the lower leg.
Oh, wow.
So there's different branches and realms that you can go with podiatry, but that's
Okay.
in a nutshell. That's kind of
So like 3, but they're all 3 years, all residencies.
correct. So there's
Okay.
all of them are 3 years. There are a couple scattered around that are 4 years, and those are in New York, New York City, and that additional 4th year is tailored into their residency program for an extra year of medical education.
Okay.
But just like in MD or DO realms, you can also do a fellowship. So that's an additional year outside of the 3 years.
Wow.
So-
Wow. That is pretty impressive. So I mean, my listeners are wondering, my goodness, that's 10 years of post high school education. I mean, does it affect you in terms of student loans? And I mean, there might have some young people
Yeah.
watching, and they're curious.
Yeah.
What's going to be my income after 10 years? Am
Yeah.
I going to have enough to
Absolutely.
pay off this student loan?
Absolutely. And that was obviously anybody's concern when they're coming out of high school, is what they're going to throw themselves into and the loan that you are going to occur. And with podiatry, just kind of we're talking about that it's similar, the training or the time as the MD and DO route.
Right.
The student loan debt is actually right on par with that aspect as well.
Wow.
So the average student loan debt for an MD or DO coming out of or finishing up everything is about $230,000, and that's actually pretty similar to the podiatry realm as well. And then you kind of ask the salary afterwards. Salary when you're compared to, like I said, when other specializations, and how we talked about, after 3 years you can pretty much start working right away, and that's actually kind of an added benefit because you don't have to kind of delay that paycheck in essence.
Okay.
With other kind of specializations. And starting out, the average salary is anywhere between 120 to about 170, with the median being obviously about 150, and that's the national average.
Okay.
And there's actually been some really good reports that are coming out, in the USA Bureau of Census. I forgot the name of it exactly. It escapes me at this point in time. That talks about how podiatry is actually one of the highest growing profession right now as far as income.
Oh, wow.
But also it's on the list of some of the most happiest medical professionals.
Job satisfaction.
Exactly.
So we need a podiatry school in Louisiana. I hope somebody is listening, because the closest one is in Florida. That's like 12 hours or 10 hours away, So we need one in Louisiana. If somebody's listening in Shreveport or New Orleans, I'm shocked we don't have one. So a lot of my patients are listening and they have Medicare, some of them have Medicaid, some of them have Blue Cross, some of them have United, some of them have WellCare, some of them have all these insurances, you know, name it.
Yeah.
So what do you accept in
So-
your office?
So at both offices,
Some have
uh,
Cigna, you know.
yeah, we
so-
actually accept almost all major private health insurance, as well as Medicaid, all versions of Medicaid, all versions of Medicare, all the Bayou programs, Blue Cross, Blue Shield. We almost cover every single major insurance carrier in the
state,
area, exactly,
right.
or that's even offered in this area. And that's obviously one of the big benefits, especially with Medicaid and Medicare, is that you know we're in a location where we can really outreach to all these patients that have these insurances that maybe they're not able to get to another kind of doctor.
Right.
So it's a very much so an added benefit, the fact that we are on so many different insurance
Wow.
companies. And in addition to that, just kind of touching base on that,
Mm-hmm.
one of our biggest kind of contributes kind of to increase our patients to come to us is we don't have you don't have to send a referral. So a
Oh.
primary care doctor doesn't need to send a referral.
Patients can come in.
Exactly.
Awesome.
So that's a big added
So
benefit.
most
to,
insurances don't need a referral.
so if you go to your primary care doctor, you don't need the primary care doctor to say, hey, here's a referral to go see a podiatrist. They can just say, oh, I know this podiatrist.
Go
You
ahead.
can go and
Awesome.
this is our recommendations.
Wow,
yes.
wow. So you need to. So I need every one of my patients. I worked in Monroe before I moved to Jackson, Mississippi. You need to go and see Dr. Christian Bailey. He's right there on Desert Street. My office was on Desert Street.
Really?
My office was right there on 2913 Desert Street. So there are 5,000 to 6,000 patients in that office, I can assure you. All of you, just take a stone throw. I think your office is at the corner with, I think, right there at the corner or something.
Right, we're right next to ULM. It's
Right next to ULM, right.
Literally right next
So
to ULM.
it's a stone throw from my old office. All of you, you don't need a referral. You just heard him say it. Make an appointment. His number is on the screen. His address is on the screen, Christian Bailey. Your feet is a signpost to your future health. If you don't take care of your feet, do you realize that if you have an amputation, the average number of mortalities after amputation is 25%. If you have a below-knee amputation, within 1 year, 25% or more are dead within a year. And most of them happen because people just don't take care of their feet.
Correct.
So we need to start a revolution, a foot revolution. Somebody out there, stop ignoring your feet. It's telling us about your health. And Dr. Christian Bailey has moved all the way from Maryland to help you do that. Join us next. We're going to continue talking to him about why he's in Louisiana and what he hopes to achieve. He came with his lovely wife and child. He's going to be an integral part of the healthcare of our community. You don't want to miss it. Join us next week. This is Dr. Toby Morma saying, Jesus is Lord. See you. God bless.